We begin with a health issue on the rise in every corner of the world: diabetes. According to the American Diabetes Association, an estimated 20.8 million American adults and children suffer from diabetes. It's a debilitating condition which, left untreated, can result in other serious health conditions, including vision loss. In North Carolina, Lions have funded a state-of-the-art medical facility to assist diabetics.
All right, so if you'll again stare at that light for me.
Inside the Lions Diabetic Eye Care Center in North Carolina, doctors are working to fight this disease.
Diabetes is a huge problem and has been for my entire career. Despite the fact that we've made significant improvements in the care of diabetic eye disease, it is still the leading cause of loss of vision in patients who are between the ages of 24 and 65. That is, the working age Americans are still losing vision to diabetes.
It's particularly devastating because it takes out a very productive population in the U.S.
Patients who have lived with diabetes for more than 20 years and who have not been able to control their blood glucose levels have a 90% chance of developing an eye disease. Robert Holt understands that reality. He's battled diabetes most of his life. He has diabetic retinopathy and glaucoma and undergoes frequent laser treatments to help preserve his sight.
Diabetes, I guess, caused a lot of problems, and when it hit me, it got me quick. It hurt me a lot on the job. It bothered me a lot with my gardening. I couldn't really tell if the plants were even sprouted or not.
At the Lions Diabetic Eye Care Center, patients like Robert receive top-of-the-line medical care and are educated on how to manage their disease.
It's very important for patients with diabetes to get integrated care, to have everything taken care of simultaneously so that they can get their care, their blood sugar, their renal care, and their eye care all in a convenient location.
At this facility, a diabetic can come and see a number of doctors and have their screening, and they maybe see a nutritionist, how they can improve their diet.
The Lions of North Carolina raised funds and secured an LCIF grant to supply the center with all of its state-of-the-art equipment, including digital photography, optical computer tomography, and laser equipment. It's a unique facility that makes an immeasurable contribution.
It allows me as a physician to really deliver the state-of-the-art care to our patients. So I just want to thank the Lions for all they do to help us do our job better.
For Robert Holt, the center has helped him reclaim his life.
I've learned a lot about taking care of my eyes. It's something that by talking to those people really enlightened me, and they taught me a lot.
North Carolina Lions have raised, on average, $100,000 per year for clinical eye research over the last 10 years. And LCIF has given more than $6 million worldwide for diabetes prevention, control, and diabetic retinopathy research.